Hello, pet parents, and welcome to another episode of Natural Pets TV. I'm Robert Semro, and I am joined by Heidi Nevela, Dr. Jodie, and Dr. Patrick. I don't think there is a topic bigger than this in the pet world. More than 50%. In fact, this is me personally, most of us are going to encounter cancer in the pet world at some point, whether it's our own pets or pets that we know and that we love and that we follow. Cancer has become such a big issue. Dr. Patrick, I know you've got deep experience with this. I'm going to throw this to you. Kick us off on this because there are so many things to know, understand, and really dive into on this topic.
Sure. Well, it's a very personal topic to me too. My own pet, who's now no longer with us, Cardiff, had T-cell lymphoma twice and overcame it twice and actually didn't die of T-cell lymphoma. He died of a respiratory issue. But cancer is something that is very common in pets these days. It's being diagnosed more frequently. We don't know why is that the case. Are more pets having cancer, or are more pets going to the veterinarian and getting that diagnosis? And the diagnosis comes from a variety of ways as well. It could be visualizing some kind of mass-like lesion, and so we then suspect that's cancer, and then that creates the process of determining if it actually is or not. Just because your pet has a lump or a bump doesn't mean that he has cancer. It means you should go to the vet and start with an exam. Measuring a lump is very important too. So we can determine, like, actually with the caliper, what's the centimeter diameter, starting out with a fine needle aspirate, so we can do a cytology, which is microscopic evaluation. If needed, maybe taking a biopsy, which is a chunk of tissue, or taking the entire mass-like lesion off for biopsy. And the whole process of going through what is cancer too. So just because your pet has this bump doesn't mean he does have cancer, but once we get that diagnosis, is it benign or is it malignant? A benign cancer still can be locally invasive and cause problems, but it's not likely to spread to other parts of the body. A malignant cancer can be very locally invasive and can spread through the blood or through the lymphatics to the heart, lungs, brain, really almost any place cancer can go. So we want to figure out what actually is going on before we then launch into like what's going to be the most appropriate treatment for pets. But we always want to just strive to also educate pet owners as well. Like if there is something, if your pet isn't acting right, if you see something suspicious, if they're not eating, drinking as well, not as energetic, get that exam with the veterinarian. It might not just be like the looking and measuring and aspirating. It might be doing blood testing and urine testing and getting x-rays of the chest and abdomen and doing abdominal ultrasound, or even more advanced imaging like MRI or CT scans or nuclear imaging. So the great thing that is available now are veterinary oncologists. These are doctors that are just exclusively dedicated to helping pets with cancer, with radiation, with chemotherapy, with surgery, and they're really the most up on what should be done for this particular pet as compared to, say, like a general practitioner who may not treat that many cancer patients. So you always can be referred, and I always recommend, actually, if somebody comes to seek me out for what kind of supplements or what kind of herbs or acupuncture can help my pet, I'm only going to work with that client if the pet also is seeing a veterinary oncologist, so they are aware of the most available options. And I guess along with that launches into our conversation of what can we do to help pets that have cancer besides just surgery, chemotherapy, and radiation. I know there's many options, and I know that you guys work with those options as well.
Mm-hmm. I would like to agree that it's extremely important that every pet parent have that initial conversation with a boarded veterinary oncologist, because you need to make a very informed decision. And actually, in my state, where I practice in Wisconsin, there is a law, an informed consent law, that veterinarians need to follow that says you need to make sure that that pet parent has all the information. And it's usually the oncologist that will be best at giving you the statistics. Is radiation recommended? Is chemo recommended? And then what is the likely outcome from utilizing that modality? So I have been practicing very holistically for a couple of decades, and so I certainly have accumulated a following of people that in general aren't interested in some of the conventional modalities like radiation or chemo. But even so, I really do send them there as well so that they can make a good informed decision, because a lot of us say, well, I would never do that, but when you're actually faced with it yourself, it really might change what you want to do. And I too have stories of, unfortunately, my own dogs and cats that I've lost to cancer. When I was a new graduate, I probably saw a couple cases of cancer every year. In order to do some of those follow-up tests, I would have to send them off to the university for those tests. But now, unfortunately, I probably deal with 4 or 5 cancer patients every day and actually have the availability now to do those follow-up kinds of tests in my own practice, which is an example of how unfortunately prevalent this is, that you have to be able to provide that kind of service on a daily basis. But I'd like to share a poignant, fabulous story about an individual that had cancer. He's become a little bit famous, a chocolate lab. His name was Blue. Okay. And he had the emergency surgery of, he was fine, and now he's down. What happened? Went to the emergency clinic and found out that his spleen had ruptured. And I find it almost seems seasonal that I'll see an epidemic of splenic masses and spleens that are rupturing because of tumors in the spleen. And they can be benign or malignant. Approximately, I think 60% of them are benign, but 40% are malignant. So in the case of Blue, this beautiful chocolate lab, way too young to have cancer. I think he was probably about 6 years old. And his splenic mass had ruptured. The emergency facility removed his spleen, saved his life. But then found out that it was malignant, and they gave him 3 months to live. And this pet guardian wasn't satisfied with that prognosis, and even the facility said that with some of the conventional follow-up treatments, even chemo, that he still wouldn't have long to live. So she decided to not go that route and came to me for my suggestions. And so what I've learned over the years, and what I learned from her even, is how important nutrition is. And so she changed from the conventional dry kibble diet that she was feeding, which is very high in inflammatory starches, and I think in a layman's term sort of feeds the cancer. Changed him to an all raw meat diet, lots of vegetables. I learned how important it is to blend dark leafy greens, incorporate those in with the food, and then a whole array of supplements. Supplements that are immune supportive. And by supporting that individual's immune system, well, we're built to fight cancer. We're fighting cancer every day if you just provide the right tools. So if you dramatically change, whether you're a human or you're an animal, if you can dramatically change your lifestyle, change what you're eating, change your thought processes. So it was important for her as a pet parent to have this good positive attitude. And I think that combination is why Blue ended up living 8 years. And we ended up having to euthanize Blue because of arthritis.
Wow.
So, and honestly, I can tell you a couple more like that, but I can't say enough how the incorporation of multiple modalities for something like cancer can really make a big difference.
Mm-hmm. And the system that I work in is based out of South American traditional medicine, but it embraces the more the Western approach, potentially, where it's chemoradiotherapy, nutritional therapy as well, and also surgical interventions. But then there's also the plant and marine-based or more herbal-based medical system, and they coexist very well. One of the reasons it's interested me is really just the plant chemistry that the plants that are used in these particular societies. The plant chemistry, what it presents, they're anti-mutagenic and anti-angiogenic, and they're cytotoxic. So just to kind of break it down, an anti-mutagenic, in the case of like an aberrant tumor or aberrant growth, will go in, first of all of these plants that have been assessed, and they've actually been studied outside of the U.S., research, assays, clinical trials, all those kind of things. An anti-mutagenic is often also an alterator or an adaptogen. So it's a specialized plant that goes in and seeks out what's really, potentially awry in that mass. So it will attempt to go in and disengage the irregular cellular activity, reset it to cell health. Then it also sends its little free radical scavenging and antioxidant and to basically interrupt the oxidative process that's going on within those cells and just reset it to health. That's The anti-angiogenic is really interesting. In order for a mass to grow, it needs to take energy from other resources in the body, other places through the blood and through the tissue. So what an angiogenic does is it goes in and attempts to interrupt the blood vessels that are being created to feed that mass. And often get phone calls that a small bump will become several diameters or centimeters, sorry, in no time. And really it's that angiogenic process that's feeding it. And then also, many of these plants are anti-tumoral just in function. So if there is something topically that there's a small mass, a lot of times in these herbal medical societies, they're applying something topically and seeing a change, but it obviously is transmitting through the blood as well. And so you've got all these really interesting plant actions that are natural, not well replicated in a synthetic form. Some of the more common names are graviola, probably heard of that. Noni is another one. There's guacatonga and Espinera santa. Sangre de Grado I talked about. Cat's claw is really interesting. It's very well known. All of those herbs either boost or modulate immunity in some form, upregulating or downregulating as needed. But cat's claw has been well studied there for its effects to reduce, the side effects of chemoradiation regimens. So that, no matter what a pet parent chooses to do as an intervention, cat's claw is a really easy, really accessible thing to add in to reduce the side effects of maybe chemoradiation, whether it's nerve pain or nausea or whatever it is, and you get that boost to immunity that ultimately they're going to need in that kind of situation. There's many more, but those are more the prominent. And what's really also interesting in South American traditional medical systems, they study these plants to be more specific for for types of cancer. We don't necessarily do that in this country. We're getting better about it, but they really have quite a long history of expertise, and they have processes in place, natural processes that they also combine with more modern, like surgical things, very effectively with the lower cancer incidence.
Some of these, I think you're going to have to put the spelling in the comments.
Yeah, I didn't make them up, but yeah, no, I know. Yeah, and it's some of them are well known, some of them are emerging. There's just and there's a lot of research going on these plants around the world. If you go to PubMed, you're going to see a lot more references to these
along
things.
the line of the plants that are becoming very popular for cancer prevention, treatment, are the medicinal mushrooms. And I've been using a collection of medicinal mushrooms for many years. My cancer patients that do the best are usually on some combination. One of them that has gotten some press is Coriolis, or turkey tail. Penn State did a study University of did a study on utilizing doxorubicin and Coriolis together, and got much better results than by using it just alone. And Coriolis is one of the medicinal mushrooms that's been in the combination, the complex that I've been using.
And doxorubicin is a big, scary chemotherapy that a lot of people are afraid of. Actually, let me just bring up the whole concept. Like, a lot of people are afraid of pursuing chemotherapy for their pet that has cancer. Chemotherapy could just be prednisone, which is a steroid that's very similar to cortisol that your body produces. So sometimes we have a lot of inflammation, which is bad for the body in general and can promote further inflammation and promote cancer cell growth and DNA changes and things like that. Just using prednisone can really help. For example, lymphoma, which is a malignant white blood cell cancer, which Cardiff have, very commonly presents with swollen lymph nodes. Even prednisone can be a chemotherapy treatment as a single agent, but it's not going to resolve the problem. It's really just going to manage the signs, which still improves the pet's quality of life. So don't be afraid of chemotherapy, be afraid of the potential for side effects. And that's why partner with your veterinarian, with your veterinary oncologist. See a person who is comfortable working in the realm of supplements and herbs and complementary alternative therapies to try to make your pet better tolerate the chemotherapy treatment. Cardiff, who had chemotherapy for almost 3 years, had very few side effects because, I believe, he ate a human-grade whole food diet the entire time. He took probiotic supplements that helped to keep his gut health functioning regular. he took a variety of herbs and other supplements that helped to complement the chemotherapy and to promote his immune system to function better, to on its own clear cancer cells before they became new tumors. So we still used our chemotherapy, but we integrated the approach with herbs and supplements and acupuncture and everything else. And exercise too. Exercise, getting the blood flowing, getting the lymphatics clearing, getting the white blood cells going to the place where they should to kill the cancer cells before they become tumors. So I'm a huge fan of that whole entire approach. And we did use doxorubicin, also known as the Red Devil or Red Death. It's a very large volume that has to be given very slowly intravenously, and Cardiff had many injections of that over the years until he kind of got to the point that you shouldn't give any more. There's a certain number that you shouldn't give. He might have gotten 1 or 2 extra because he had cancer twice. So there's a variety of approaches that you can potentially take that can be extremely helpful. And even in my practice too, besides the probiotics, besides the whole food diet, somewhat recently I became familiar with using extracts of the cannabis plant to help with whole body health, to help with inflammation, to help with pain, to help with nausea. And I really saw Cardiff show a better response and fewer side effects to his interesting combination of chemotherapy when he was taking a CBD-based product. And he would take it morning and evening, small amount of liquid added to each meal, and I saw no side effects from it, and he generally seemed to feel better. And so I've actually taken that same product and have used it with patients that have other conditions, glaucoma, liver and gallbladder issues, arthritis, seizures, dementia, and I have seen some response with it. A lot of it is to try to reduce reliance on other medications that have side effects. So I have seen that, and it seems to be becoming more accepted as a means of therapy, provided it's something that I feel is specific for pets. I don't suggest people go to the human cannabis store and get like a brownie that has it and feed that to their pet, or get something that has like cherry or grape flavor. So it's really important to get that product that's very specific to your pet, and that's where like partner with your veterinarian. Seek out a holistic veterinarian. The American Holistic Veterinary Medical Association, AHVMA, has their own website, ahvma.org, and you can easily find a holistic vet in your area. That's what I suggest people do if they like contact me for help and they're not in my immediate area and I can't take them on as a client and help them.
There are a lot of CBD products on the market now, and so we do have to be careful. The big difference, of course, with those and the typical marijuana is the lack of the THC. Right. That's that psychoactive component that we want to avoid. And I've used a few in my practice on my patients as well as my own pets. I have 2 18-year-olds, and one has arthritis. The other has some canine cognitive dysfunction. And then I unfortunately have a little dog with a liver shunt, and so sometimes he has seizures. And I have found too that the CBD is very easy to give, and am seeing some results with it as well.
I also want to ask why we're seeing so many more instances of cancer these days. Has it always been there, or is this a new phenomenon?
I think it's a newer phenomenon. I think it always has been there in some capacity, but I think that it's being diagnosed more frequently. Pet owners are more aware of it now, so they're going to the veterinarian, they're getting the examination, they're getting the diagnostic testing done to confirm the suspicion of cancer. But then also we have to think about pets are fatter than they've ever been, and obesity promotes inflammation and can contribute to various diseases, including cancer. So there's definitely a strong correlation that's been proven between obesity and female dogs and mammary cancer. And so I think we have to take that and apply that approach to all patients. So that's where I really advocate pets eat that whole food, moist, fresh diet throughout their lives that isn't rich in starches and things like that to keep them lean. But then also we have concern from substances that go into commercially available pet foods, which often are lower quality than human foods and contain feed-grade ingredients. And pet foods are allowed to have higher levels of aflatoxin, which is a mold-based toxin, which itself is carcinogenic, along with damaging the kidneys and the liver and the immune system and the digestive tract. So for feeding processed foods that have higher levels of toxins, it's going to cause a negative effect in the body and can contribute to cancer. And there's always the scare too with things like immune stimulants. There was a problem in the late 90s related to vaccinations for cats, feline leukemia vaccinations that contain something called an adjuvant, which causes the immune system to turn on. So some cats developed sarcomas, which are malignant skeletal muscle tumors, directly at the site of vaccination. But sometimes injecting anything into the body actually over time could contribute to the same thing. So ultimately, fortunately, it was worked out that it was this component, they removed it. I'm not seeing that as a trend in pets anymore, in cats having vaccine site sarcomas, but I generally try to think about like how could we do a little bit less immunostimulation. So instead of maybe just getting that vaccine because it's due, of course following legal requirements, but maybe we consider testing the blood to see if there's sufficient antibodies from the prior vaccinations. Because having my own dog with cancer and also autoimmune disease, we could never really figure out what caused his autoimmune disease. Was it a vaccination at some point? Was it something in his environment that was triggering it? We just don't know. So we just want to try to avoid unnecessary immune system stimulation by thinking a little bit outside the box, testing the blood, seeing what the antibody level is. It's called a vaccine antibody titer, and I highly suggest it for all patients after your puppy and kitten series are done, and of course following the legal requirement for rabies vaccination too.
We do a lot of titer testing in our practice, and I think that's made a big difference. I actually used to see feline leukemia related problems in the past a lot more than I do now. I think other lifestyle things to consider, possibly even the young age spaying and neutering. That's a very controversial issue. I understand the pet population problems, but I think taking your ovaries away at such a young age and taking your testicles away at a young age. There's studies now that are showing an increased incidence, especially of the bone tumors in large breed dogs when they're neutered. Two of my oldest living golden retriever patients were 14 years old and had never been neutered. Of course, golden retrievers are an easy breed, and there's other, behavioral reasons why people neuter their pets, but I think we need to think about that when we're looking at reasons for an increased incidence in cancer.
And I think we have to continue the discussion on toxicity in our environments, whether it's food, water, home environments, outside.
Our laptops.
Yeah, assessing
cell phones.
And our own personal behaviors we're projecting onto our pets, the stressful environments in our homes, potentially because they react differently and perceive stress differently. But read labels, keep looking at the chemical constituents that you're consuming or giving to your pets to consume, or just the personal care products you're using. All of that has the potential to create a toxic load in our pets that outpace their ability to eliminate
and our
it.
busy lifestyle and contributing to not giving them enough exercise.
Lack of exercise,
obesity that you
right.
mentioned, and
limited lymphatic function. I mean, there's so many reasons, but at least continue the conversation on all of these because they potentially all are related to the increase.
So as you can see, this is a topic that has so many things to know about, so many things to discuss, and probably many more things to learn. It's very important for all of you to be working with an expert, in fact, maybe a team of experts, but it's your job as a pet parent to be communicating. You are the observant of your pet and you're the voice for them. So when you're talking with those experts, note the changes over time, note what you're seeing, note what's going on in your environment. This is such an important topic and all of us are being touched by it on a more regular basis. So take notes, be communicative, and work with an expert or a team of experts. I want to thank our experts because this was a great starting point and we will continue the conversation on this important topic. Thanks for joining us here on Natural Pets TV. Hey everybody, thanks for joining us. It was another great episode with a lot of great information and we really appreciate you keep the conversation going in the comment section down below. And don't forget to subscribe to the channel as we have a lot of great episodes with a lot of great information coming to you with a lot of great guests. And if you want more information on our guests, for Heidi Nevela, you can get that at naturapetswithaz.com, Dr. Jodie at drjodiesnaturalpets.com, and Dr. Patrick at patrickmahaney.com. Thanks for joining us, and we look forward to seeing you soon.